So this was an incredible session. Do you mind introducing yourself?
Absolutely. I'm Derek Chu. I'm from the University of Calgary in Calgary, Canada.
And can you tell us a little bit about this session, about AI and wearable technology in EP?
This was a whirlwind session in terms of, what AI has accomplished in terms of arrhythmia detection, as well as where AI is going. Dr. Freeman was talking a lot about his work, or his group's work at the Mayo Clinic, and it's not just about arrhythmia. It's detecting diagnoses and really, hopefully, streamlining clinical practice to improve patient care and avoid the terrible complications that misdiagnoses.
And also, you guys mentioned a lot about wearable technology.
Mm-hmm.
So where are we right now in the era of wearable technology for cardiovascular disease?
Being first-hand users of consumer wearable products, I think right now arrhythmia detection, atrial fibrillation detection, it's well sorted out in terms of access and being able to diagnose atrial fibrillation. What we don't really know is the full impact of these consumer wearables and the impact on the healthcare system. Atrial fibrillation is an atrial fibrillation. Are 5 seconds of atrial fibrillation or 30 seconds of atrial fibrillation the same thing as being days in atrial fibrillation? We know not. So the answer is no. But then how does this influence consumer psyche, anxiety, and the interaction with the health system? I think it's really important to empower people to have control over their health data. But how we act on, or how we help engage with the consumer once they have this health data, that really hasn't been worked out. And so I think that this is an opportunity to try and sort out kind of the interaction between wearables, the consumer, and the healthcare system before the deluge of other sensors that are going to come imminently in the next couple of years.
And I think that's extremely well said, because we all have patients that bring us an enormous amount of data, and the question is, what do we do with this information? And so this session is extremely timely, and I hope we see more of this at cardiology meetings.
Absolutely, absolutely.
Unrelated to this, what's one thing outside of this world that lights you up in your own life?
Not cardiology EP related?
Non-cardiology, non-EP, what is your thing?
Well, I live in Canada, lots of snow. I love skiing, so
Amazing.
Banff, fantastic.
So we have an AI wearable expert who also enjoys skiing.
Yeah.
Thank you so much. It's so nice to meet
Very nice
you.
meeting you.